That means, of course, my insurance company is going to pay that 5.5%. I mean, I'm not going to pay it. Once I bust my deductible, I don't need to worry about that.
That's right.
Except, of course, my insurance costs goes skyrocketing. All right, Linda, explain this to me, because this is the shell game part. Now, you said before that when S-CHIP, kids insurance, when the state pays $1, the feds give the state $2. On Medicaid, no, excuse me, Medicaid, $1 that we spend at the state level, feds kick in another.
Right.
All right, so what happens to this extra 5%, this tax?
Well, the idea is that if you as the state can get the hospital to charge more, say it cost you $100 before, again, the example I used earlier, now you're going to get more money from the federal government than you did before. And if you run the numbers, the state makes out, well, I mean, its budget burden goes down with this. But all that money's coming from the private sector. So this Affordability Act, I calculated, is going to pull, the fiscal note says, about $630 million a year out of private health care in Colorado. It's going to raise my cost by $630 billion.
Let me stop that.
The Affordability Act.
So
yes.
the Affordability Act, which won't be put on any line item on my bill when I get my bill, will be hidden in the cost, is going to bring in over $600 million a year from hospitals.
No, from people who pay hospital bills.
From people who pay hospital bills to the hospital, from the hospital to the state.
Right. And then the state will turn, and the state, what's happened here then is the state has expanded Medicaid tremendously with this bill. So it's the idea that is being preached to everybody is, well, we get free Medicaid expansion. This is free health care for all because we get this federal match. And even some of the supporters were so sloppy as to say, well, the federal match equals the amount that we're taxing everybody. Well, it turns out it doesn't. I ran the numbers on the program expansion. The hospitals are taking $630 million in from private patients. The state is spending about $500 million on the program expansions. There's $130 million slopping around the system that's used to make the state administrative people happy because it pays administrative costs. And then there's some money that's going to go to the hospitals to increase their total payments because they went along with the deal too. So that's why I called it a slush fund in the background.
What I don't understand is why would the hospitals, why would Denver Health, for instance, why would they sign off on this? That's the part I don't get. Help me understand that.
Well, they get more total revenue. They have to raise the money, the first money, but then they get back extra money from the federal government. That's part of that $500 million a year that we're going to be tacking on to our kids' and grandkids' federal credit card.
Right.
And instead of you keeping the money in your pocket, the hospital gets to keep it.
Okay, so let me see if I understand this shell game here, because this is tricky, but this is great. So the hospital raises 5% more from everybody. They don't tell anybody, it's not on your bill, but they take it. And because of that, they have to then hand it to the state, but the state says, look, our Medicaid costs and our S-CHIP costs have gone up by 5%. So please, federal government, give us $1 for $1, or in some cases $2 for $1, more money. So this is a way to pull more money from the federal government that we then spend for more Medicaid patients, and so more people are covered by Medicaid.
Right.
Well, then why is this a bad thing?
Because
I mean, we're getting money, we're getting free money from the feds, and yes, we're going to be paying 5% more that we'll never know about. It'll just be part of that health care increase, but we're going to be able to cover more people with Medicaid.
Which is fine if you like a single-payer system, a socialized medical system. This is another step in that direction. And this expands it to the level where, for a family of 4, you would qualify for your kids free medical care at these hospitals if you make $55,000 a year as a family. For my family of 5, it's $64,000 a year. It's a significant expansion of the medical welfare rolls.
Oh, hang on, slow down there. Let me see if I get this. So right now, if you have 2 kids,
right,
and your family brings in about 50 grand a year, you can put your kids on S-CHIP.
Right.
So there's no reason for somebody a household making 50 grand a year to go out and actually buy insurance for their kids if you could get it free from the state. Is that the idea?
Absolutely.
Nationally, the figures show that at the low levels of income, 60% of people dropped private insurance to put their kids into S-CHIP. So all you're doing is substituting taxpayer money for private money. These people had been paying for their kids' insurance perfectly well, but now we're going to give them a freebie by taxing sick people.
Well, and it's actually worse than that, too.
Yeah, it's worse
because
now, yeah.
When you are on private insurance and you go see the doctor, the clinic, you probably have a copay. So you're at least paying part of the expense yourself out of your pocket, and the insurance company is covering the rest of it. When you're on S-CHIP or Medicaid, your copay is $1.50 or $2 or $3. It's not anywhere near
literally half a couple dollars.
Oh yeah.
All right.
Absolutely. And so you can understand why Colorado citizens would make the rational decision to stop paying extra for the private health insurance and stop paying extra when they go to the same clinic that you can go to get the Medicaid or S-CHIP type of care for your kids. It's a rational decision that I don't blame them for making. I just think it's wrong for government to encourage them to do that.
What was, when you get to the bottom of this, we understand there are people out there who need help. We understand that there are families who can't afford care for their kids. This is a shell game. And I would admit, or wouldn't your colleagues admit, even the people who are promoting this admit, yeah, this is a way to milk more federal dollars to Colorado so we can get more Medicaid and S-CHIP money that we can spread around here. Isn't that the whole purpose of this?
Yes, that's exactly what they said as their justification for doing this. 40 other states are doing it. We need to do it too.
But the problem is that it's not just milking the federal government. It's taking a phenomenal amount of money out of people's pockets who pay for their own health care, who are responsible now. They're taking $630 million away from people who pay privately now. They're transferring it into the Medicaid program so that they can get more federal funding, so that they can take more people out of the private sector, so fewer people are actually paying. This weakens the entire private sector. And as far as helping kids, it doesn't necessarily help kids, because what it's really doing is enrolling a whole bunch of healthy people who don't need a lot of health care. That dilutes the state's focus on people who really, really need help. And there is no testing in here to see. I mean, what this program does is it says if you're a ski bum and you live with your mom and you make $10,000 a year, you know, doing seasonal work, they'll pay for your medical care.
This will pay for it.
Mm-hmm.
Absolutely. That's a brand new program, never been done
Never
before.
been done before.
What do you mean it's a brand new program? What are we talking about?
This is a brand new eligibility class.
Single, adults,
Adults
healthy.
without children who make less than the poverty level.
All right, so if you're an adult, staying at your mom's house, now you get insurance.
Absolutely.
Wouldn't it be better if we have people who need money? You were talking about 60% of the people who enrolled in S-CHIP actually had private insurance.
Mm-hmm.
If they were having a hard time making ends meet, wouldn't it be better just to give them cash and let them continue to buy their health insurance?
Lots better. I ran the numbers. The governor's press release said 100,000 extra people would get health insurance through this. Now, maybe that's not accurate. I don't know. But let's use his numbers. $630 million taken out of the private sector to cover 100,000 people. You do the math, that's about $6,300 a person. Okay? Let me give you an idea of what private insurance costs. For a person in the individual market in Colorado, if you're healthy, you pay $2,000 a year roughly. If you're very, very ill, you go to Cover Colorado and you
Cover Colorado is
guaranteed issue insurance for people with cancer, with HIV/AIDS, you know, people who are uninsurable.
Let me bring back these numbers. So you're saying when you took this amount of money, $630 million out of this new tax increase, fee increase,
Tax.
and when you break it up to the people it's going to now give coverage to, it's over $6,000 per individual.
person.
Now, all right, if you're a healthy person, you can get insurance for $2,000 a year, but a lot of these people have pre-existing conditions. They can't get existing health insurance, but a lot of folks don't know there's what's known as a high-risk pool. Is that what it's called?
Yes,
Cover Colorado.
in Colorado.
Which guarantees that even if you have bad health, you can get insurance.
Yes.
And what does that cost?
Well, that's a subsidized premium, but I ran it for a 55-year-old person. It's about $6,000 a year.
It's expensive.
But it should be expensive because it's for a variety of reasons. But so that gives you, that's very expensive. It's still less than the amount to cover each individual person here. And keep in mind that most of these people that are being included in this expansion are healthy. They're kids, they're single adults, they're not sick. Most people in the U.S. are not sick, you know, and can get individual insurance. So yeah, give people cash would be a lot cheaper. Plus, they'd get medical care. Medicaid, it's very tough sometimes to get medical care. You have to wait a lot.